There is something you do every single morning without thinking about it. Something so automatic, so completely ordinary, that it has never once crossed your mind as something worth questioning. You wake up, you open your eyes, and then you get out of bed. That's it. That's the moment. Not what you eat for breakfast, not whether you take your medication, not how much you exercised yesterday. The moment your body transitions from horizontal to vertical, the way you physically move from lying down to standing up, maybe silently placing your brain under a level of stress that most people over 60 are completely unprepared for. Neurologists and cardiologists have been paying close attention to what happens inside the aging brain during those first 20 seconds of the morning. And what the data continues to show is deeply unsettling. Not because it involves something rare or complicated, but because it involves something that everyone does, every single day, in a way that almost no one ever stops to reconsider. The mistake is not dramatic. It doesn't announce itself. There is no alarm, no obvious warning, no clear signal that something is going wrong. That is precisely what makes it so dangerous. It is the kind of risk that builds quietly, accumulates invisibly, and then, on the wrong morning, under the wrong conditions, reaches a threshold that changes everything. What you are about to hear is not a theory. It is not a fringe idea from the margins of medicine. It is based on decades of research into cerebrovascular physiology, morning cardiovascular patterns, and the specific biological vulnerabilities that develop in the human brain after 60. It is information that cardiologists and neurologists discuss among themselves regularly, but that rarely makes its way into a conversation with a patient in a 15-minute office visit. By the time this video ends, you will understand exactly what happens inside your brain during those first 20 seconds after waking. You will understand why the way most people get out of bed creates a window of neurological vulnerability that the aging vascular system is increasingly unable to compensate for. And you will have a simple, 4-step protocol, something that takes no equipment, no medication, and no more than 20 seconds, that can dramatically reduce that risk starting tomorrow morning. But before we get there is something important I need you to understand about what your brain is actually doing the moment you open your eyes. Because without that foundation, the rest of this will not make complete sense. And this is a conversation where complete sense matters. If you are watching this for the first time, take a moment right now and subscribe to this channel. We publish content like this regularly, specific medically grounded information about how to protect your brain and your cardiovascular system as you age. Hit the subscribe button and make sure you never miss what comes next. Now, let's talk about what is actually happening inside your head every single morning, and why the clock starts the moment you wake up. Most people assume that the brain simply wakes up when they do, that the moment consciousness returns, everything is already running at full capacity. That assumption feels logical. It is also wrong in ways that matter enormously for anyone over 60. While you sleep, your body enters a state of controlled physiological reduction. Blood pressure drops, heart rate slows. Your vascular system, the network of arteries and capillaries that feed every region of your brain, reduces its tone and pressure in a way that is calibrated for horizontal rest. Think of it like a city at 3 in the morning. The power grid is still running, but demand is low. The infrastructure is operating at reduced capacity. Everything is stable, and the system is not prepared for a sudden surge. Then the alarm goes off. In the minutes before waking, the body begins a rapid hormonal transition. Cortisol levels rise sharply, adrenaline increases, blood pressure begins to climb. This is called the morning blood pressure surge, and it is one of the most well-documented phenomena in cardiovascular medicine. What makes it significant is not that it happens, it is entirely normal, but that it happens while the brain is still in the process of restoring its full vascular regulation. The brain is the most metabolically demanding organ in the human body. It accounts for roughly 2% of body weight, but consumes nearly 20% of the body's oxygen supply. And that demand does not wait. The moment you regain consciousness, your brain begins pulling oxygen from the blood at a rate your cardiovascular system must immediately respond to, with precise, rapid adjustments in blood pressure and blood flow. After 60, that response is no longer what it was. The walls of the arteries have stiffened. The carotid arteries, the 2 large vessels in your neck that carry blood directly to the brain, are frequently narrowed by decades of low-grade inflammation. The small vessels deep inside the brain have lost much of their ability to dilate and constrict rapidly. The system that was once fluid and adaptive has become slower, stiffer, and significantly less forgiving of sudden change. This is where the mistake enters. The vast majority of adults get out of bed in one continuous motion, Swing the legs, push up, stand. 3 to 8 seconds, start to finish. It has always felt normal, but when the body shifts rapidly from horizontal to vertical, gravity pulls blood downward toward the legs. The cardiovascular system must respond immediately to maintain blood flow to the brain. In an aging vascular system, that compensation is slower, less complete, and far more likely to fall short. The result is a transient drop in cerebral perfusion pressure, a brief but real reduction in blood reaching the brain. Here is the critical point most people have never been told. That moment of dizziness when you stand up too fast is not nothing. That is not just aging. That is your brain telling you, in the clearest physiological language it has, that it just experienced a measurable drop in blood flow. Most people dismiss it. They wait a second, feel it pass, and move on. They have done it hundreds of times. Nothing happened. So they keep doing it. But the absence of an obvious consequence is not the same as the absence of risk. And this distinction becomes far more important once you understand what else is happening inside those vessels every single morning. There is a reason strokes do not happen randomly throughout the day. The data from the American Stroke Association is consistent and striking. Ischemic strokes, the kind caused by a blockage that cuts off blood flow to part of the brain, occur disproportionately in the first few hours after waking. Not at noon, not in the afternoon. In the morning, shortly after getting up. The biology behind this pattern is not difficult to understand once you see the pieces together. After several hours of sleep, the blood becomes measurably thicker. Platelet aggregation, the tendency of blood cells to clump together, increases during the night and peaks in the early morning hours. The blood is, in a very real physiological sense, in its most coagulable state of the entire day precisely when you wake up. At the same time, the morning blood pressure surge is sending a sharp wave of pressure through vessels that have been in a low resistance state for hours. And if those vessels contain even partial obstructions, narrowed sections, small plaques, areas of reduced elasticity, that pressure wave can do things that a slower, more gradual increase would not. Now add the movement. A rapid transition from lying down to standing, twisting the torso, projecting the head forward, rising abruptly, creates a sudden gravitational redistribution of blood volume at exactly the moment the brain is most vulnerable. Thick blood, elevated clotting tendency, stiffened vessels, impaired autoregulation, and a sudden mechanical disruption of blood flow, all in the same 20-second window. Her name was Margaret, 71 years old. She walked her neighborhood every morning, cooked her own meals, managed her own finances. Mild hypertension, controlled by medication she had taken for years without incident. One Tuesday morning in October, she woke at her usual time. She swung her legs over the side of the bed, pushed herself up and stood, the same way she had done thousands of times. But this morning the room tilted. Her vision darkened briefly at the edges. She steadied herself on the nightstand. A second passed. It cleared. She told herself she had gotten up too fast and went to make coffee. By mid-morning, the words she was trying to say were not coming out correctly. Her right hand felt clumsy. She sat down. She told herself she was tired. Her daughter found her 3 hours later. Margaret had experienced a transient ischemic attack, what most people call a mini-stroke. The imaging showed a small area of restricted perfusion in the left hemisphere. She recovered, but her neurologist was direct with her in the hospital. That moment when she stood up and the room went dark was not nothing. It was a warning, one that had come before, in smaller, quieter ways she had never recognized as significant. The terrifying truth about strokes is not that they arrive without warning. It is that the warnings are so ordinary, so easy to dismiss as just getting older, that they pass unrecognized until something larger forces the conversation. If you have had mornings where standing up left you briefly lightheaded, where your vision flickered, where you had to steady yourself, this conversation is specifically for you. Not to frighten you, to give you something you can actually use. There is a protocol, a simple 4-step sequence that takes 20 seconds, and it can begin protecting your brain starting tomorrow morning. But first, there is one more factor I need you to understand. Something present every single morning without exception that amplifies everything we have discussed so far. If you have been looking for a complete, structured approach to protecting your cardiovascular and cerebrovascular health, I want to tell you about something specific. In the description below and in the pinned comment, you will find a link to a comprehensive program designed for adults over 60, addressing morning vascular stability, blood pressure, circulation, and brain protection. There is also a QR code visible on your screen right now that you can scan if you are watching on a television. Go there now. The link is in the description and the pinned comment. The QR code is on your screen. Every morning, without exception, you wake up dehydrated. Not severely, but measurably, physiologically, consistently dehydrated. During sleep, the body loses fluid through respiration and perspiration without any mechanism for replacement. By the time you open your eyes, your blood volume is meaningfully lower than it was when you went to bed. Lower blood volume means reduced plasma, the liquid component that carries oxygen and nutrients through the vascular system to the brain. Research published in the Journal of Gerontology and corroborated by work from Frontiers in Aging Neuroscience has documented the relationship between even mild morning dehydration and reduced cerebral perfusion in older adults. The effect is not catastrophic in isolation, but it is additive. It compounds the orthostatic challenge of standing. It compounds the increased blood viscosity of the early morning. It compounds vascular stiffness. Each factor alone is manageable. Together, on the wrong morning, they create a physiological environment the aging brain is genuinely not equipped to absorb without consequence. This is what physicians call orthostatic hypotension, the drop in blood pressure that occurs when you move from lying to standing. In younger adults, the body compensates so rapidly it is almost never perceptible. After 60, that compensatory mechanism becomes slower and less reliable. The baroreflex, the system of pressure sensors in the aorta and carotid arteries that signal the heart and vessels to respond, loses sensitivity with age. The vessels themselves, having stiffened over decades, cannot constrict and dilate with the speed and precision they once could. What this means practically is that the brain, that city dependent on constant electricity, experiences a real reduction in its power supply every time an older adult stands up too quickly. Most of the time the system catches up quickly enough, but the brain is not infinitely tolerant of repeated hypoperfusion. Cumulative reductions in blood flow contribute to white matter changes, cognitive decline, and increased vulnerability to ischemic events. The Mayo Clinic and the National Institute on Aging have both published guidance consistently identifying orthostatic hypotension as an under-recognized risk factor for falls, cognitive decline, and cardiovascular events in older adults. The specific role that morning behavior plays in triggering that risk is less commonly discussed in patient conversations. The way you physically get out of bed is not a passive act. It is a cardiovascular and cerebrovascular event. After 60, it deserves to be treated as one. Every morning that passes without implementing what I am about to share is another morning your brain navigates that 20-second window without protection. That is not a reason for panic. It is a reason for intention. The program available through the link in the description, the pinned comment, and the QR code on your screen right now addresses this complete picture: hydration strategy, morning blood pressure management, circulation support, and brain protection across the entire day. Scan that QR code or click the link below. What you do in the next 30 seconds may matter more than you realize. Now let's give you the protocol. The protocol is simple. It takes 20 seconds. It requires no equipment, no medication, no special physical condition. What it requires is only the decision to do it, every morning before your feet touch the floor. The first step begins before you move at all. The moment you become conscious, keep your head on the pillow and take 3 slow, deep breaths. Inhale fully, hold briefly, exhale completely. This is not a relaxation exercise. Deep breathing activates the parasympathetic nervous system, which helps stabilize the initial morning blood pressure surge and begins to prime the cardiovascular system for the transition ahead. 3 breaths. But those 3 breaths give your brain a measurably more stable vascular environment before anything else happens. The second step happens while you are still lying down. Before you sit up, begin moving your feet. Flex them toward you, then point them away. Rotate your ankles. Squeeze and release your calf muscles several times. The calves function as a secondary pump for venous return. When those muscles contract, they push blood back up toward the heart and brain. By activating that pump before standing, you begin rebuilding blood volume in the central circulation before the gravitational challenge of rising. You are preloading the system. This takes 15 to 20 seconds and should feel effortless. The third step directly addresses the orthostatic risk. Sit up slowly, using your arms rather than jerking upright, and then stop. Sit at the edge of the bed with your feet on the floor and wait. 20 seconds. This pause is not trivial. It is the window within which the baroreflex system detects the change in position and signals the blood vessels to increase their tone. It is the window within which the cerebrovasculature begins adjusting to the new hydrostatic demands of the seated position. In those 20 seconds, the brain's autoregulation system has a chance to catch up before the far greater gravitational challenge of full standing. The fourth step is brief but important. When you are ready to stand, do not look down at the floor. Fix your gaze on a point directly in front of you. A picture on the wall, the doorknob, a window. Rise slowly, maintaining that fixed gaze as you come to full standing. The visual fixation point gives the vestibular system, the brain's orientation center, a stable reference during the gravitational transition. In combination with the prior 3 steps, it dramatically reduces the likelihood of that transient darkening of vision, that brief unsteadiness, that moment of orthostatic vulnerability that for too many people has become simply part of their morning. 4 steps. 20 seconds. Beginning tomorrow morning, the brain you are protecting has carried you through every decision, every relationship, every memory that makes your life yours. It is not slowing down because it has given up. It is navigating a biological environment that has become more demanding, and it needs you to meet it halfway. Small adjustments matter. The research on orthostatic management in older adults consistently shows that behavioral modification produces measurable reductions in hypotensive episodes. You do not need to overhaul your life. You need to change 20 seconds of it. The people who benefit most from this are not people who have already had a stroke. They are people who have had those mornings where the room tilted for just a moment and they told themselves it was nothing. If that is you, now you know what it was, and now you have something to do about it. If this gave you something real, something you will actually use tomorrow morning, click the like button right now. Subscribe if you haven't already, because the next video continues this conversation in a direction that matters just as much. And leave a comment below. Have you ever experienced that dizziness when you stand up in the morning? Tell me how often. Your answer shapes what comes next. There is someone in your life who gets out of bed every morning the way Margaret did, who has had those mornings and dismissed them. Share this video with that specific person, not with everyone, with them. Subscribe so you are here for the next video. You came here looking for something worth knowing. Carry it forward.